Hi, I'm Daisy Ilchovska of Optimal Health Nutrition, and today I'm going to be talking about vitamin D and autoimmunity. As part of this Optimal Nutrition series, vitamin D is a very important vitamin for human health. Its importance is highlighted by the fact that every single cell within our bodies have got a receptor for it, which is like a little socket for vitamins and hormones. Vitamin D helps regulate our immune system, which is like the army of soldiers that protects us from viruses, bacteria and pathogens, and it also has got a key role to play in key physiological processes such as bone health and inflammation. So what is vitamin D? Vitamin D is a fat-soluble vitamin that is found in very few foods. We actually synthesize vitamin D from bare skin exposure to the sun, which means that your level of this vitamin may depend on where you live and how often you go on sunny holidays. Here in the UK, the NHS actually recommends that we all supplement vitamin D throughout the winter months, which is especially relevant for vulnerable individuals such as older people. I would like to dedicate this very short video to the role of vitamin D in autoimmunity. Now, autoimmune conditions are something very close to my heart. I have an autoimmune condition myself, and this was the whole reason for training up as a nutritional therapist. And I also did my research dissertation on the role of vitamin D in a very debilitating autoimmune condition called rheumatoid arthritis. In addition, I very often discuss vitamin D levels with some of my clients who have autoimmune conditions themselves. Now, autoimmune conditions, what are they? As I've mentioned before, your immune system protects you from harm and keeps you healthy. But in autoimmune condition, it actually gets confused and starts attacking your own tissues, which is your joints in the case of rheumatoid arthritis, your thyroid gland in the case of Hashimoto's, and it could be your skin, brain and kidneys in the case of lupus. In fact, there are over 80 recognized autoimmune conditions. Research suggests that some people with autoimmune conditions have got really low levels of vitamin D, and supplementation may be able to help with some of the symptoms. Furthermore, in some genetically predisposed individuals, actual vitamin D supplementation may prohibit disease initiation. This may be because vitamin D has got a known immunomodulatory effect, meaning it helps regulate the immune cells of our immune system, such as dendritic cells and T cells. However, vitamin D supplementation for people with autoimmune conditions has to be optimal, meaning that's usually much higher than what the NHS here recommends, which is between 25 and 50 nanomoles per litre. However, you just have to be mindful that because this vitamin is fat soluble, meaning it's stored within your fat cells, in some very rare occasions you may overdose. When you work with a registered nutritionist, they may also consider other factors that are really important and are linked to your vitamin D levels, such as genetic polymorphisms, which are variations of your DNA sequence, your skin color, where you live, your lifestyle, and also other factors such as excess weight and any medication you might be on, such as corticosteroids, which have been known to lower vitamin D levels. It is really important that when you do supplement vitamin D, to actually supplement the bioavailable form, meaning that you get the maximum absorption from vitamin D, and that's vitamin D which is best absorbed when it's combined with another vitamin called K2. However, if you are on any medication, including prescription medication or over-the-counter medication, it's best to work with a professional because there may be some interaction between the supplementation and the drugs you're on. Hit the like and subscribe button below if you found this video informative. I'm Daisy Ilchovska, registered nutritionist, founder of Optimal Health Nutrition, and I'm wishing you a happy and healthy day.